It is my honour today to rise to speak on the Health Legislation Amendment Information Sharing Bill of 2023. There are two main elements of this legislation of which the Liberals and Nationals have significant concerns. And that is specifically around the provision for all information to be uploaded to this system on a mandatory basis of there not being either an opt-in or an opt-out element. Second element that there is deep concern in the community around is that this legislation specifically exempts the Department of Health from an administrative perspective to be subject to freedom of information requests.
The last few years have shown us how important information sharing needs to be, particularly in urgent situations. And I think with COVID, people in this space can understand how if you've had COVID, it is actually important for whatever medical professional you are seeing, it's important for them to know that, because we know that long COVID is a thing and we still don't fully understand how having COVID can actually affect your body and affect your organs, affect how you move, affect a whole bunch of things.
To be able to have health records that follow the patient, to be able to understand what issues that history of that patient may have is absolutely crucial. The fact that we have more information on our cars when we take them for service than we do on our mums and dads and family members is a disgrace. The proposal from the member for Lowen, which is a reasoned amendment, is a very important one. It's a fair one, it's a reasonable one, because what it does is it gives the rights, the responsibility to the patient to opt out if they want to opt out.
If you've got an issue about opt-out, and this should have been clarified in some of the contributions, there is the most stringent security controls on this platform, and there hasn't been a history of a breach with the department.
I'm more worried about those organised crime gangs and others around the world that we've seen access Optus, Medibank and other large institutions that I would gather would be far more sophisticated at protecting their data than the Victorian government.
Chronic disease now accounts for 80% of ill health, which does flow through to hospital presentations. Many patients attending Victorian hospitals will have been there before, often to receive treatment for the same or related conditions. Now, furthermore, most Victorian patients will visit more than one health service for healthcare and treatment.
The sharing of patient information will not involve the consent or knowledge of patients with no opt-out option available. While the aim of the bill strives to improve medical outcomes, this does need to be balanced with and give thought to patient autonomy. As we've heard earlier, 1 in 10 Australians opted out of My Health Record. There is no doubt a significant percentage of the population would prefer an opt-out option or believe in the concept of patient choice and autonomy.
The allegation was that patients cannot FOI their own health data. And that is just plain wrong. This bill does not change a patient's right to access the full medical records from their health service provider under FOI and privacy legislation. You can access and audit records to see who saw your medical records as well.
If a patient from my electorate is normally cared for at the Royal Melbourne Hospital, but that's full, and they wind up at St Vincent's, just a few minutes walk away, their medical record from the Royal Melbourne Hospital is out of reach, and at 3 a.m, vital information may have to wait until the morning. Patients actually, in my experience, generally assume public hospital doctors already have access to the information from elsewhere in the public system. And they're surprised when we explain that we don't. So rather than opting out of the whole system, we should consider whether it could be feasible for patients to either nominate certain facts or information be omitted from being uploaded to the shared platform, or for their record to not be available at their request to the wider group of health agencies listed in the legislation and only to public hospitals where they are a current inpatient.